Hello, I'm Aaron Miller, Medical Director of the Corinne Goldsmith Dickinson Center for Multiple Sclerosis and Professor of Neurology at the Icahn School of Medicine at Mount Sinai in New York. We're going to discuss management of patients with multiple sclerosis. I'm joined by Dr. Bruce Cohen, Professor in the Davey Department of Neurology and Clinical Neurosciences at Northwestern University's Feinberg School of Medicine in Chicago, Illinois, and Dr. Clyde Markowitz, Associate Professor of Neurology at the Hospital of the University of Pennsylvania in Philadelphia. Bruce and Clyde, I'd like to start off by talking about a case that represents a fairly common occurrence, at least in my practice, and I'm sure in yours. Let's say, Clyde, that you're referred a patient who is a 34-year-old young man who was in a recent motor vehicle accident. He was rear-ended and didn't seem to have any severe injuries at the time, but he began to complain of some persistent headaches. So his primary care doctor ordered an MRI. And the MRI, to his surprise, was loaded with T2 hyperintense lesions. Several were located in a periventricular area. He even had one in the cerebellum, and he had a couple of juxtacortical lesions. So, thinking that he might have multiple sclerosis, he refers the gentleman to you for your opinion. And let's assume that he has a normal neurological exam, and I'm sure you would take a careful history for starters.
Yeah, so we do see a lot of these recently because the use of MRI has really increased over the last 10, 15 years, and it's not uncommon that I will see people with this exact issue. So, when we look at the MRI, we try and determine, is this MRI scan, more suggestive of MS, or is it in a non-specific pattern? And as you describe it, it sounds like it's in a classic distribution for lesion location, maybe size of lesions, that would be concerning for MS. Meaning if this patient had symptoms, you would be saying this patient probably has MS. But because the patient has no symptoms, and we're assuming that I've taken in a very detailed history and I can't find anything in his history to suggest any numbness or weakness or blurry vision or anything in the past,